Dr. Bowens, we're here discussing your book, Vasectomy The Cruelest Cut of All. Who would benefit from this book?
The book is about post-vasectomy pain syndrome, which is a major complication and a very real one resulting from vasectomy. So who would benefit? Anyone who's considering vasectomy. It needs to hear the real scoop on it. Anyone who cares about the person having a vasectomy, and also people who are unfortunate enough to have this very severe condition.
So how does a man know he has post-vasectomy pain syndrome?
That's a very interesting question, because one of the problems with it is it can arise weeks, months, even years, even up to 15 years after the vasectomy. And with that time frame, it's very difficult sometimes to link the two. Doctors have to know that this is a very real phenomenon and occurs in about 15% of vasectomies, very severe in about 5%, because if they don't, it's often misdiagnosed. Frequently, this person who suffers is told that it's in their head by various doctors, which just adds insult to injury. But by realizing that it is an actual condition that arises from vasectomy, there's no doubt about that, then you can make that linkage between the vasectomy and the pain, even if it's years later.
You mentioned that vasectomy is referred to as a safe and simple procedure. Is that not so?
Simple, perhaps, in the right surgical hands. Safe, absolutely not. This is one of the rhetorics that exists in this area. Safe and simple procedure. In going through many of the journal articles, almost all of them said safe and simple procedure. It was almost like they had to put that in to get the article published. And that is a rhetoric that floats around, and it is absolutely not. It's got a very severe and hard to deal with pain condition associated with it, so it is not safe.
What options exist for those suffering from post-vasectomy pain syndrome?
One of the reasons I wrote this book is to make people very aware of this, and also aware of how difficult it is. Many pain syndromes are very hard to treat, and this one is extremely difficult. It requires very expensive and hard to locate, often, microsurgery techniques. Frequently, these aren't funded by healthcare plans. In the third world, where vasectomy is being heavily promoted as a safe and simple procedure, treatments are essentially non-existent. The man just suffers. That's it. And often the pain is worse during sex and activity, which makes it even more difficult to live with it.
How does a man recognize that he has post-vasectomy pain syndrome?
As the name of the condition suggests, pain, and as I mentioned earlier, it can be years later even. But if there's pain arising in the testicle or on that side, because sometimes it can be diffuse pain, assume that it is from that source.
So do you think that vasectomy should still be performed?
No, I believe that it should be ended. I think in decades or 100 years from now, they'll look back and think, oh, why'd they do that? It's be seen as a barbaric procedure that is not needed, because there are other options out there for birth control. So I think it should just be stopped, period.